Hello and welcome to On Point. I'm Gina Wong. A new flu season is beginning in the midst of a pandemic, and health experts believe there's a high chance that both seasonal influenza and COVID-19 will spread at the same time. The symptoms of the flu and COVID are similar, so getting a flu shot this year will be more important than in the past, especially since treating COVID-19 patients has already strained the healthcare system. Government health experts say when similar viruses that act like the flu are spreading around, getting a flu shot reduces a person's chances of getting sick. The U.S. Centers for Disease Control and Prevention says people who've gotten their flu shot are 40 to 60% less likely to need to visit the doctor. The CDC recommends any person who is 6 months and older should get a flu vaccine every year. And now, Cal State Northridge is making flu shots mandatory. In an August email, CSUN's president said that all students who come to campus will be required to have a flu shot by November 1st. It is a part of the university's new safety plan. Today, we are going to talk about the potential impacts of ending both a flu season and a pandemic at the same time. On Point's Chloe Hooper has more on the story.
Thank you, Gina. Today, I have the pleasure of speaking with Dr. Linda Reed, who is the director here at the Student Health Center, Caitlin Barr, who is a professor in the Department of Health Sciences, and Brianna Marroquin, who is a communications major at Channel Islands. Thank you so much for being here today. I hope everyone is doing well.
It's a pleasure to be here.
Thank you.
Thank you so much for having us.
So I do just want to start off directing my first question towards Dr. Linda or Caitlin. It can be directed towards both of you guys.
We'll dive in.
Perfect. Will getting a flu shot lower our chances of getting COVID-19?
The flu shot is a very good preventive tool for influenza, the flu. It doesn't protect you against COVID-19, but what it does is it keeps you healthy and keeps you from getting the flu and needing to go to the doctor or the hospital where you might be exposed to COVID-19.
Got it. Yeah, I think that's something that a lot of people are wondering if the flu shot will protect them from more than just the flu. But thank you. I don't know if Caitlin, you wanted to say anything else about that?
That was perfect. That was, it's a great tool, but again, only really contains the influenza virus, so really only protects against influenza.
And one of the things that I think it's important for folks to know, the vaccine that's available for folks in most typical college age groups and older is a killed vaccine. In other words, there's no live influenza virus inside there. You can't catch the flu by getting the vaccine. So unless you have a medical contraindication, we encourage everybody to get the flu shot because it'll either prevent the flu or keep you from getting as serious a case of flu. Now, one of the things that happens, let's say one did get sick with the flu. If you get sick with the flu, it is possible that your immune system may be so busy fighting off the flu that there may not be enough weaponry there to effectively deal with COVID-19 if you happen to get co-infected, and that can happen sometimes.
Wow, okay. Great. Yeah, that can be scary. And also, how bad can we expect this year's flu season to be?
Great question. Unfortunately, we don't know at this time how bad it's going to be, but one of the good things is a lot of the public health prevention measures that we're recommending for COVID actually will help prevent against influenza. Things like wearing masks, washing your hands, social distancing, and then, add to that the flu vaccine. All of those will hopefully help to minimize what we're seeing this year in terms of flu season if everyone correctly adheres to those public health guidance.
We also recommend covering your cough and coughing or sneezing into a clean tissue, which you dispose of in a place where other people aren't going to touch it. The new flu vaccine that's coming out this year and that's available right now does protect against 4 strains of flu, and I would definitely recommend it. Now, there's a chance that the flu virus might mutate. It might change a little bit, so we can't guarantee 100% that you'll be protected. But we think that even if you do get the flu, which we hope you don't, that it'll be a much less severe case.
Thank you, Dr. Linda. Yeah, I think going back to what Caitlin said as well about recommending the recommended precautions, social distancing and wearing a mask. And I know that CSUN is kind of enforcing a lot of those precautions. So that's when I just want to direct this question to you, Brianna. You attend Channel Islands. Do you kind of have an idea of what precautions they're putting into place or what they're recommending you guys do? I'm assuming it's something similar to what we're doing here.
That is a great question, but yes, we are doing something similar, just like CSUN, social distancing as well. And I do know for a fact, like, I do have a lot of friends who are currently resident advisors, and currently we're still providing housing for students that do need it. So we do provide those precautions and having them all separate rooms and keeping a mask on, staying 6 feet apart. Our office has completely changed to having shields for us and shields around, so there's no contact or per se like those clear shields. And then same thing is that, and when they have to schedule an appointment, because I do know they just announced that our health center is now doing flu shots by appointment. Once again, they're keeping that distance of 6 feet apart and keeping those scheduled, only doing scheduled appointments at this time if people want to pursue having a flu shot.
Got it.
We should also add that flu shots, if you have insurance or Medi-Cal, flu shots are generally available free of charge at your local pharmacy or grocery store pharmacy. So that's an excellent, convenient place to get a flu shot if you haven't had one already.
Yeah, that's really good information to know for viewers out there who are wondering where they can get a flu shot, who want one. I know, Brianna, you just mentioned that your school is giving flu shots. Will Dr. Linda, will the Clot Center be offering flu shots to students?
We have flu shots, but we are trying to follow the Los Angeles County Department of Public Health guidelines of reducing density on campus, reducing the number of people coming to campus. So instead, especially if you have insurance or Medi-Cal, you can get your shot for free locally where you live close to your home rather than coming to the health center. We do know that some of our students may have economic challenges and may not be insured. And so we're making special arrangements at the Student Health Center for appointments for flu shots for students that don't have insurance or Medi-Cal.
Okay, so students can make appointments. That's good to know. And also, I think you and Caitlin might have touched on this a little bit, but since COVID is still spreading, is it more important for everyone to get a flu shot this year than other years?
Absolutely. I would say a flu shot, is one of the prevention things that we can do to help reduce the impact right now on the healthcare system. So something that we've seen with COVID throughout is really trying to reduce the load that we're seeing in hospitals, reduce the load that we're seeing on healthcare workers. And one of the best things that we can do now is try to reduce cases of influenza, especially severe cases that might threaten to overwhelm the healthcare system while we have the COVID pandemic happening right now as well. So definitely really important, not just for kind of preventing either, but also minimizing the risk that our healthcare system throughout the country will be overwhelmed by having both at once circulating.
The CDC recommends, especially this year, that anyone over 6 months goes ahead and gets the flu shot. Now, some folks may have a medical contraindication, but your doctor or healthcare provider will be able to assist and let you know if that's a concern for you. But most people will do fine. You won't get the flu. And if you don't get the flu, you stand a better chance of fighting off COVID-19.
Also joining us for this conversation is the lead nurse here at the CSUN Clot Center, Marisol Garcia. Hi, Marisol. I will direct my next question to you, Marisol. We have gotten an email from the school that it's really strongly encouraged and recommended to receive the flu shot before coming back to campus. I think Dr. Linda and Caitlin did touch on this a little, but hearing from you would be nice too, being a nurse at the Clot Center. Why would they want to require this before coming back to campus?
Well, every year it's very important. It helps reduce the number of cases of moderate to severe levels of flu. But this year especially, we're highly recommending it because of the COVID situation that we are in. Although they are two different viruses, if we already have a tool such as the flu vaccine to help protect people from the flu at least, then it will hopefully reduce the amount of people who need to get hospitalized. Some people can have a severe case of the flu, which would require hospitalization. But if they have received the flu shot, many times, even if they catch the flu, it's a milder case where they could probably take care of themselves at home, therefore leaving resources and personnel available at the hospitals and urgent cares and ERs to help with the patients with COVID.
And a follow-up question for that would just be, have the benefits of the flu shot always been there, regardless of the pandemic?
I'd say yes, and I'd say it varies from year to year in terms of what people's perception is about how effective it is, and that's because it's a different. There are different strains every year, and it's a different formula every year. And sometimes our scientists get it right on, and it's very effective, and sometimes not so much, and it may not be as effective. However, I would say that in any case, getting it is always the most effective thing you can do to protect yourself from getting the flu and being very ill with the flu.
Great. Thank you, Marisol. This next question I do want to direct back to Brianna. How have you and your fellow classmates been handling this? Having to be in quarantine, kind of doing Zoom classes. I just kind of want to know from you, from a student's perspective, how has this been for you?
It's been a lot of ups and downs, I would say, not just for me, a lot of classmates, because we do attend, some of my courses do have meetings and we do talk about these things. And it's just sometimes a little overwhelming. It's something that we didn't see coming, but yet when we know it's for the safety and making sure the COVID-19 does not spread among campus. So of course it has been tough because some Zoom classes and some majors besides my own could be a lot harder compared to others, such as me as a communications mentor. It's kind of been easier transition compared to, for example, someone who's a biology major and has to do labs and everything. Totally different format. So it's all our environments are different and it's a little harder, especially also as a senior. It's very upsetting to see this humongous switch of throughout now this whole year will now be virtual, and a lot of seniors just as me are feeling like we don't know what's going to happen with commencement. We don't know what's going to happen for spring semester besides knowing virtual classes are happening.
Right. And Brianna, if you've been back to campus, what precautions have you been taking, or have you not been back to campus at all?
I was on campus for a little while, and of course, save precautions, staying 6 feet apart, having a mask, having hand sanitizer on me just in case if I sneeze or something. I want to make sure I feel clean and I feel safe as well, compared to a lot of other people who have also been on campus. But overall, I just take the same precautions that are addressed as staying 6 feet apart, mask, not having full contact in the same room for a long period of time.
At CSUN, one of the things that we have done to help folks decide as if they should come to the campus or not is we have a screening tool which asks some questions about possible exposure to COVID, which asks if you have certain symptoms such as fever or sore throat or respiratory distress or nausea, vomiting, or diarrhea that might signal COVID. And if any of those things happen, in other words, if you've been close to somebody who may have been diagnosed with COVID, or if you have symptoms, then we ask folks to either call the Student Health Center or your family doctor and get instructions about how to stay safe. And we like folks who are not feeling well to stay home, not come to campus, and rest in what we call isolation, staying 6 feet away from others, not sharing food or eating utensils, preferably not sharing a bathroom. Folks who've been close contacts with people who have COVID-19, and that means being closer than 6 feet for 15 minutes or more, are considered close contacts and are generally asked to quarantine for 14 days in general. And we usually encourage folks, or your family doctor or the Student Health Center will, to get tested for COVID if you're in either of those categories.
And Dr. Linda, also, I know you guys have been recommending that we should get the flu shot. Let's say a student decides they don't want to receive the flu shot. What do you suggest they do from there? How can they keep, if they decide to come back to campus, how can they keep other students and faculty safe? For Marisol, Caitlin, or Dr. Linda, whoever wants to jump in on that one.
Marisol, take it.
That's a good question because our own actions we have seen have an impact on those around us. And there are valid reasons why very few, the number is few, but there are very valid reasons why someone may not get a flu shot. So especially now, I would just say practicing the recommendations for COVID itself would do just the same for the flu. So the distancing, the masking, hand hygiene, and just being mindful about where you choose to go versus staying home. What you're touching, do you really need to be touching that? It's an awareness that has been highlighted by COVID, but it works just the same for any virus, really, including the flu.
Brianna, I want to know from you too. Do your peers feel like the flu shot is needed? Have you discussed that with them? Have you guys received the flu shot?
Well, yeah, for my peers and my family members, we all encourage us to all get flu shots. So
Okay.
we currently, majority of us are about to have our flu shots or have an appointment currently that for later on that are having flu shots, because we do have I do have a household personally that does have a lot of health conditions, health issues. So it's like important for all of us to make sure we stay safe and we make sure we're providing our own needs, especially if it's going to benefit us in the future, because we don't want to get sick, for example, and think it's COVID and go through that route of having to go to the doctor, or having to go get tested, even maybe it just be the flu.
Right on.
It's wonderful.
Yeah.
Yeah, and Marisol, I know you mentioned that there could be a lot of reasons why a student would receive the flu shot. What would some of those reasons be? Just underlying health conditions or?
Well, there's some questions that each student or anybody would consider and answer prior to accepting a flu vaccine. And one of those is an allergy, a true allergy, a truly identified allergy to eggs, or something I saw new was chicken feathers. So I guess it kind of ties in together, but that was new. Also, a history of Guillain-Barré syndrome. Most people don't know what it is, but if you've had it, then you do know, and that may rule it out. And there may be other medical conditions where those who have it, their physicians have already had that discussion with them, so they would know whether it would be advisable or not to get one. So there's some variability there, but the general questions we ask include those, as well as a temporary deferral, meaning that say you plan next week to have an appointment to get a flu shot and then you start feeling ill. You don't want to get a flu shot if you're feeling ill. So you might hold it off until you feel better. So those questions that are asked of each person prior to receiving the vaccine, they're very important to consider and answer honestly. And then it doesn't necessarily mean you won't get the vaccine, but it's something to discuss further with your nurse or your doctor.
That's a very good point, because sometimes people feel, well, I have an egg allergy, and that means I can never get this vaccine or other vaccines, but there are some cases in which it is safe to do so.
Yes.
So your doctor or nurse practitioner or other healthcare provider can help you sort through safety issues about vaccination.
And I do just want to ask the question to Caitlin, Dr. Linda, or Marisol, whoever has knowledge on this one. I know the school sent out an email strongly encouraging that we all come back when it's time to come back to campus. We have received a flu shot. Is there any way that campus officials will be able to track whether students have received that, or just kind of?
I actually, at this point, in some settings, for example, I teach pediatrics at UCLA. And in those settings, what they are able to institute a requirement and to actually track, they're asking for proof that you've had the vaccination. We're not able to do that in the CSU. So what we're asking is for what I would like to say community enthusiasm from our CSUN community to help protect ourselves and each other by getting the flu shot if it's safe for you to do so. And for most people, it is.
Yeah, I think that's really what it's going to take, is just for everyone to kind of cooperate and follow guidelines and receive the flu shot before coming back to campus. So,
And again, I do want to say for students for whom the economic cost of the flu shot is a challenge, please call the Student Health Center because we will help you get the flu shot in a way that won't impact you economically.
My next question I will direct back towards Brianna, which is being a student, I think you might have touched on this a little bit, but being a student, do you feel more safe at home doing online classes, or would you rather go back to campus but following social distancing guidelines, wearing a mask, social distancing? How would you feel more comfortable from a student's kind of perspective?
From a student's perspective of how COVID is currently, I would say best to stay home, stay online. As much as like I know, just like me, I wish to be on campus. I wish to see everyone have a normal semester in here. I know it's for the better, like to be more smart about this with how the pandemic is currently is and with the cases rising and lowering multiple times. Like it's best to probably stay home, be virtually online, and transition to something that yes, we don't probably want, but it's best for everyone, including myself.
Yeah, I think a lot of us too, like me being a student, like we're like, oh, we miss campus. You know, some of us feel like it's harder to be on Zoom, but it is kind of what's best right now with what's going on. So,
Oh yeah.
And we can see just as a faculty member, we see our students struggling with that and how much, we wish to be back on campus as well, to be with you in class. And so, we appreciate all the efforts that everyone is doing to understand how unique of a situation that we're in and how much this isn't ideal. So, know that we recognize that as well as faculty.
yes, Caitlin, you being a
I
faculty,
would
I'm sure.
add that they talk about social distancing, and I like to use the word physical distancing because I don't want us to distance socially. I would like us all, even if it's not perfect, and I agree that Zoom and FaceTime and Skype and other types of remote communications are not ideal, but please reach out to others, reach out to faculty, reach out to healthcare providers and personnel that can help you. Reach out if you're feeling sad or depressed. Our university counseling services is open and provides telehealth services with counselors. Our student health center is open. Marisol can talk about some of the services there. So we want you to be distanced physically, but we want you to know that we're here. We want to hear from you. We want you to connect with us. And especially if you're feeling challenged, please reach out to us.
I think a lot of students should take advantage of the services that the Klotz Center offers. There's so much things that you guys offer. And Marisol, I know that Dr. Linda said that you could kind of touch on some of the services that you guys offer.
Sure, sure. Our hours are a little bit augmented than normal, not too much, but we are open from 9 to 4 with a closure from 12 to 1. And we have designed a different way of entry, shall we say, into the Student Health Center in that most of the time students could just walk in or call and schedule an appointment to come in. But we actually have a system where you'll first speak with a clinician, a doctor, a nurse practitioner on the phone to do a visit with them so that they can determine what's going on and what level of care you might need. Sometimes they are able to give advice during that visit so that the student can take care of themselves at home, or they're given resources if there's a better place to go to seek the care they need. Otherwise, they're scheduled for to see a doctor or a nurse practitioner here at our center. Also, we have triage nurses available. We are continuing to do TB screening for students who are working in the community or volunteering, or it's a requirement for them wherever, or sometimes employment. So we're still conducting those. It just takes an appointment. We're also administering vaccines, not just the flu vaccine, but other vaccines that students that may not have received that they're due for, or a series. So maybe they've had 1 out of 3, so they need to stay on track and come in for their second or third. There's also some students coming in to get medication administration that is intervaled every 6 months or so. They're still able to come in and get that. Our sports medicine doctor, a couple doctors are available specifically for sports medicine matters. And we have a women's health specialist Let's see. Right now, our chiropractic and physical therapy care is on hold, so we don't have that. But if we cannot provide the care that you need, we can very much help you to seek the resources locally or to get that care for you.
One helpful example, sometimes people need renewals of their medication or a new medication, and we can go ahead and do that with a televisit. And then we have a curbside pickup service
Yes.
so that you can pick up your medication without having to come into the healthcare facility.
Thank
so,
you.
That's another service we try to help out. Thanks, Maisel.
Sure. One quick thing. We also have our lab up and running and our radiology for x-rays that are if the doctor sees that they're needed.
Thank you, Marisol, because I don't know if a lot of students are aware of the services you guys offer, so whoever watches this can really take advantage of that. And I just got word that we are running out of time, and I want to thank you guys all for being here today and speaking with me. Thank you, Dr. Linda, Caitlin, Marisol, and Brianna. Thank you so much.
Check out our website, CSUN as one, because there's a wealth of information there and resources for you. CSUN as one.
CSUN as one.
Thank you.
Perfect. Thank you so much.
Thank you.
Thank you.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Come on, let's go.
Just a minute, I gotta finish this.
Wait, you're gonna post those pictures of Mary?
Yep. She thinks she's so hot.
But her mom and dad will see them. Her grandmother, her little sister, everyone she knows, it's gonna kill her.
Who cares? Just a couple of pictures. It's no big deal.
No big deal? Don't. This has gotta stop.
With Julia's autism, loud sounds can be too much.
But she still loves to make music.
Yeah.
Play band.
Early screening for autism can make a lifetime of difference. Find out more at screenforautism.org.
CSUN students who are looking for a flu shot can call the Klotz Student Health Center to make an appointment. There, uninsured students can get vaccination free of charge. Students with insurance pay $15. Thank you for watching CSUN's On Point. You can follow us on social media at CSUN On Point. You can hear us on KCSN 88.5 FM on Sunday morning at 5:30. You can watch us on Santa Clarita Valley Television and on LA 36. You can hear our show rebroadcast on the radio on 88.5 KCSN on Sunday mornings at 5:30. To get more information about our show, go to csuntvnews.com. For producers Alexia Mersola, Muhammad Kokar, Desiree Leon Rosales, and moderator Chloe Hooper, I'm Gina Wong.